Can you hear me okay? No. Is that better? Is it not on? A little closer. Is this better? Yeah. Okay, thank you. Thanks so much for having me. I'm Kelly Chajka, and I'm an optometrist. And like I was just introduced, I just opened a vision therapy office in January of 2023. And I want to talk to you today about maximizing your functional vision. So eye and vision disorders can negatively impact activities of daily living, such as the ones that were just mentioned, like reading, can be things like driving, navigating, and walking, which can really result in decreased quality of life. In Parkinson's disease, as we know, dopamine is not present in the levels that it's needed, so this actually affects the visual part of the brain and the retina as well. So it has many effects on the eyes and vision. So I just wanted to talk a little bit about how our vision works in general. If you look at the left side of the diagram on the top, do any of you remember using a regular film camera? Okay, yeah, same. So the way that a camera works, let's say you're taking a picture of the blue butterfly, the visual information goes through the lens of the camera. It's inverted and it's onto the film in the back of the camera. Likewise, we have on the bottom left, there's a side view of the eye. So if you're looking at that same butterfly, that information now goes through the lens of the eye. It's inverted and it's onto the back of the eye called the retina. Now, as we know, when you're taking a picture, when you take a picture with a film camera, you don't automatically see your photos. So do you remember what's the next step you would have to do? Developing, yeah, exactly. So likewise with our vision, we're not actually seeing anything yet when the information is on our retina. The way that we see is actually in our brain. So our brain is the process that develops the visual information. So if you look on the right side, you can see the eyes are actually an extension of the brain. The retina is actually neural tissue. So the brain is really the way that we are seeing. Parkinson's can affect both the retina that we just discussed and the brain. So some newer studies are finding that retina actually has several layers, and with Parkinson's disease, some of those layers are thinning. That can, in and of itself, cause difficulties with vision, such as decreased clarity or acuity, trouble with color vision. It can affect eye movements. It can affect contrast sensitivity. And then when you look at the brain, there's not only one area in the brain that processes our vision. It's spread throughout the brain, and there are several areas involved that all need to work together in order for us to see and to use our visual information. So if any of those areas are affected, you can have a visual difficulty arise. So some of the things, just to mention again, that vision problems can contribute to: difficulty with reading, paying attention, some loss of mobility, which leads to some loss of independence. There's actually vision contributes to the increased risk of falling as well. And just to kind of go over briefly, that there's a lot of different types of eye care professionals, and sometimes people get confused about which is which. So just to kind of go briefly through the different types. An optician, so that's a person that typically would fit your glasses, that they have a lot of knowledge about lens design, optics, and they're the ones helping you to get everything all set with your glasses. An ophthalmologist is a physician, so they're medical doctors. They go to medical school and then they further specialize as eye doctors. They're very much the experts in eye disease and surgery. So if you need a cataract surgery, if you are getting some sort of treatment for your macular degeneration, those are your ophthalmologists. An optometrist, which is what I am, we go to optometry school for 4 years. We have a little more emphasis on prescribing patterns, so glasses, prescriptions, and we actually have more emphasis on vision therapy and rehab, so that kind of area of vision is more often with optometry. And then if you further look into the different types of optometrists, you may have heard of a developmental optometrist. This is somebody who will look beyond just acuity and beyond eye health to see how you're actually using your eyes to receive information, process it, and then to efficiently use that information. So a lot of people, when they hear 20/20 vision, they may think that means perfect vision. It really is only one piece of vision. There's many different aspects of vision that need to be working appropriately for us to function in our visual world. So, excuse me. So some vision problems actually do go undetected because somebody may be able to read the 20/20 line and their eyes look healthy, so they may be told everything looks fine, when there may actually be a visual problem. So just to zoom in on the eye chart a little bit, the line, if you look on the screen, it has a red bar underneath. That is the 20/20 line. What 20/20 means is you'd be standing 20 feet away, and then that would be the size of the letters you would want to be able to read at 20 feet. So again, it's really just measuring a very important aspect of vision, but it's not encompassing all of vision. So what are some of those other types of problems that you may have? Some people do have what are called ocular motor or eye tracking problems. This is one of the more common findings in Parkinson's if there is a vision problem. There are different types of eye movements that we make. One kind is called a saccade, and that's when our eyes move quickly from one position to another. And we're doing that all day long. Very small, precise saccades are required for reading. So when we read, our eyes are moving across each line. When we get to the end, they have to make a very precise movement back to the beginning of the next line and continue along on the next line. So those eye movements are very important for reading. Sometimes with Parkinson's, the initiation of those eye movements can be impaired, or the accuracy of those movements can be impaired. And to give you an example of what it might look like if you're trying to read and you have an ocular motor disorder, you can see that for this reader, they're jumping around, they're skipping lines, moving back and forth. This is another example. If your eyes are not moving along systematically and taking in the information, you can see how it would be very difficult to know what you're reading or retain what you're reading. Another common visual finding is problems with binocular vision or using your eyes together. So Parkinson's can lead to difficulty keeping the two eyes pointing in the same direction. Sometimes it does lead to double vision, which can be intermittent or may sometimes be constant. When we look in the distance, we want our eyes to be pointing straight ahead. When we look up close, we want our eyes to do something called converge, so our eyes have to come together and point at that near object and stay there comfortably. So as in when we're reading, each eye is actually getting a slightly different view of the world, and the brain is putting it together. And if those two images are not lining up properly, that's when you start to have some of that double vision occurring. As an example, if you don't mind the pictures, if you're looking at the right side, this is an example of reading. If you have a convergence or an eye teaming problem, you might be reading along and then everything can start to blur or double. This might happen intermittently. For some people, it happens frequently. So that would obviously be very uncomfortable to read that way. So that's another way that reading can be affected negatively. So you can imagine for driving also, this would be very difficult. So if you're seeing double when you're driving, trying to decide which lane you're in and which lane all the other cars are in can obviously become a problem. Some people are only seeing double intermittently, so they can do okay on the eye chart because that's a pretty quick test, but it might be on a long drive that, at some point things may begin to double. If you think about navigating, if you're seeing double, like if you could imagine trying to walk up the bottom left of those stairs, it would be very difficult to know how high to lift your foot. So some of the signs that you may be having a binocular vision problem, sometimes you'll see people either tilting or turning their head. A lot of times they're trying to kind of block an eye so that they're really just relying on one image, and that other unrelated or the other image that isn't lining up is blocked. You may actually see double vision. You may have trouble with spatial judgments, like stepping up on a curb or going up and down stairs, navigating. Some people will actually end up closing an eye. I've had several people that don't realize that, oh yeah, when I'm reading, I'm closing my eye, and then come to find out if they didn't close their eye, they'd be seeing double. They might not realize, but that's an adaptation that they've made. Sometimes you may not see outright double vision, but you may have a lot of eye strain or headaches, and that comes from all the effort that's expended to keep the eyes working together. And then sometimes you may even see somebody has an eye turn. So you may have seen this before where you're talking to somebody and one eye is pointing straight ahead and their other eye may be turning in or out, or up or down. So sometimes that can also be visible. Another very important aspect of our vision is our peripheral vision. So the brain actually has two what are almost considered separate visual systems running at the same time. There's our system for central vision, what we're looking at, what we're taking detail from, and then there's our peripheral vision system, which is helping to orient us in our environment. They do interact, the two systems, but they are running, in we think, some separate areas of the brain simultaneously. If you have trouble with your peripheral vision, you can see things like spatial disorientation, difficulty navigating, bumping into things. They actually think it contributes to freezing, the freezing phenomenon. It can affect your concentration, balance, coordination, posture. So our peripheral vision is very important. We don't always think about it as much as our central vision, but it is a very important aspect. So peripheral vision we found is vital to help with preventing falls. So just going back to that original diagram, the two eyes, the black line or the straight lines are just looking straight ahead. But the other areas are where we're seeing off to the side, and each eye has a slightly different field of view. So I roped somebody into a demo. It's amazing. It's a really big venue, so hopefully some of you will be able to see this, but I have Liz from Engage who's going to come up and help me demonstrate. Thank you, Liz. Okay, so I'm going to have Liz sit at the chair here. I'm going to try to get out of your way. I'm not sure if can I take this out or, thank you. Okay, Liz. So we're going to first test that your central vision is okay. So if you look straight ahead, are you able to see that chair in front of you?
Yes.
Excellent. Okay, so I'm going to have you stand up and go ahead and take a seat in the other chair. Excellent job. I'm going to have you come on back over to this chair. Okay, great. So now what I'm going to do to poor Liz, I'm going to put these goggles on her, and what these will do is they will distort her peripheral vision, and we'll see how that affects her balance and coordination. Do you mind? Okay, Liz. Can you still see the chair in front of you?
Yeah.
Okay, so that part is intact, but let's see what happens now that her peripheral vision isn't functioning properly. Go ahead, stand up, go ahead, take a seat.
This is like a fun house.
So you can see it took a lot more, she was more unsteady, she kind of had to decide where she was before she took a seat. Sometimes you'll see people actually kind of hold on to the chair. So hopefully some of you could see that, but thank you very much. I won't make you come back to the other chair. Thank you, Liz. I can figure this out. Okay, thank you. Another thing to think about when we're discussing peripheral vision is, do any of you wear glasses that have the no line, bifocal, progressive lens? Right, so they're really nice because they allow you to see at all different distances in one pair of glasses. One downside to this lens design is just by nature of the lens design, there are areas in the lens where the periphery is distorted. Unfortunately, they haven't found a way to kind of design them without that being the case. So when you are wearing progressive lenses, there are studies that show it really increases fall risk. So that's something to consider. There's a lot of benefits, but there are also some things to consider if you're having balance or navigation issues. So for some people, what I'm doing is actually prescribing separate pairs of glasses, so a pair for far away, maybe for driving or walking, and a pair for up close, reading, computer. That's annoying because then you're switching back and forth between glasses, but sometimes the benefit outweighs the downside. So that's just something to consider. The same thing is true for the lined bifocals. They've found that increases fall risk as well, because if you look down and you're looking through your bifocal portion, things are not as clear. So just again, something to consider. Another difficulty that we find that's higher than usual, happening more than usual and than just a typical person is dry eye with Parkinson's. The reason is it causes a decrease in the blink reflex. So we have tears coating the outside of our eye. Every time we blink, those tears are being refreshed and coating the outside of the eye. If you're not blinking as much or you're not blinking fully, that front part of the eye can really dry out, which can be very uncomfortable. It can lead to intermittent blurred vision. It can lead to inflammation. There's also an increase in problems like eyelid spasms with Parkinson's disease. So some of the treatments that you can think about can be as simple as over-the-counter artificial tears that you can buy at the grocery store, over anywhere you can get a medication over the counter. Those can be helpful. There's for the inflammation on the lids. There's different lid wipes that they do over the counter as well. There are actual treatments for the lids as well. There's one called IPL, which is a light treatment, which helps a lot with inflammation. There are a few optometrists in the area offering that. It's a little bit of a newer technology, but there are some options. And then for the eyelid spasms, there's a possibility of Botox treatment, and that would be a referral out to ophthalmology for that type of treatment. So just to kind of summarize some of the symptoms that may be occurring if you're having a visual issue are things like difficulty with reading, if you're losing your place, if you're seeing double, headaches, eye strain, vision may be contributing to balance issues, so that's something to figure out, is that a piece of it? If your vision is blurry or if it's going in and out of focus, if your eyes feel dry or irritated, if they look red. And then one we didn't touch on yet, but if you're having, some people do have visual hallucinations, so seeing things that are not there. And I've found that often patients are hesitant to bring that up because they're afraid of what people will think, but that is something that happens. So if you are finding that to be the case, that's something to bring up. That can be medication related or it can be related to Parkinson's itself, but always important to address it if it is occurring. The way that one of the surveys that I send out to people when I'm doing an evaluation is here. So going over some of the different vision symptoms that you might experience. So things that we talked about: eyesight clarity, comfort with your vision, double vision, dry eyes. Light sensitivity, that's actually very common after concussions, and I see a lot of people post-concussion, so that's why that one is on there. But a score of 32 or higher indicates you might want to look into things further and really see what's going on. So what can we do about these problems? So there's different things we could try. There are glasses that may be a little different than the typical glasses you may already have. There's something called prism, which is a type of lens that can help if you have double vision. It can help bring those images back together into one. Sometimes that can be very helpful. There's different kinds of prisms. Sometimes they can help with balance, or if you're leaning one way, or if you have that kind of head down posture. sometimes those types of prisms can help with those things as well. This is actually a prism, but this is not the kind that we would prescribe, so in case anyone was wondering about that. Another treatment is phototherapy or light therapy. There are some interesting things coming out about light in Parkinson's. Some people have looked at using, if you've seen those lamps people use in the winter for seasonal affective disorder, some findings are showing that actually can help reduce some of the symptoms of Parkinson's. Some people have looked at just using really bright fluorescent lights, which sounds horrible, but for an hour before bed, that seems to, for some of these studies, reduce symptoms. And one of the newer studies is looking at a particular green light. So those studies are ongoing. One of the treatments that I offer at my office is something called Syntonics, which no one's ever heard of, but it's a light therapy. It uses different frequencies of light to help for those who have some sort of neurological problem, whether it be post-concussion, Parkinson's. Sometimes that can be very helpful to add on to the treatments you're already doing. And then the main focus of my office is vision therapy. So typically I'll do an evaluation, and if someone is a good candidate, we may sign up for the weekly vision therapy. So this is like, kind of the way I describe it is like physical therapy, but for the visual system. And there's many different activities and different processes we can use to kind of address the areas that you're having a problem with. This is my information for my office. I'm always happy to talk or answer any questions to the best of my ability. That's the office phone number and the email. So I welcome talking to any of you and any questions that you may have. If you're wondering about finding an optometrist who works in this type of area, these are two really good organizations, NORA, the Neuro-Optometric Rehabilitation Association. And then the next one, what used to be called COVD, it's rebranded now as OVDRA, but that's another good website for finding optometrists that are in this kind of realm of vision rehab. That's all I had. Thank you very much. Thanks so much for having me.